The Apple Watch started life as a fancy step counter and notification screen. But over the past several years, it's quietly transformed into something remarkable, a genuine health and even medical device on your wrist, with features cleared by regulators like the FDA. It can take a heart tracing, spot an irregular rhythm, detect a hard fall, and more. In this episode, we'll separate the real, clinically backed features from the wellness ones, what the Apple Watch can genuinely do for your health, and, just as importantly, what it can't. The most genuinely impressive feature is heart rhythm monitoring, and this is where the Apple Watch crosses from gadget into medical territory. It can take an ECG, an electrocardiogram, which is an actual electrical tracing of your heartbeat, the same basic signal doctors use. You put your finger on the crown, and in 30 seconds it records a single lead tracing. Its main job is to screen for atrial fibrillation, or AFib, a very common irregular heart rhythm that often has no symptoms but significantly raises the risk of stroke. On top of the on-demand ECG, the watch also monitors your rhythm passively in the background and can notify you if it repeatedly detects something irregular. These features are cleared by the FDA, and there are real, documented cases of the Apple Watch flagging AFib that people had no idea they had, sending them to a doctor who confirmed it. For a wrist device, that's genuinely powerful. Beyond the heart tracing, there's a whole suite of health features, and it's worth knowing which are which. Fall detection is a standout. The watch can sense a hard fall, and if you don't respond within a minute, it can automatically call emergency services and message your contacts. For older adults living alone, that's genuinely life-saving technology, with real stories to prove it. Blood oxygen measurement estimates how much oxygen your blood is carrying, though it's positioned as a wellness feature, not a medical diagnostic. There are heart rate alerts for unusually high or low rates when you're at rest, which have also caught serious hidden conditions. And there's the everyday stuff, cycle tracking, sleep, wrist temperature, and emergency SOS. It's a lot of capability, but notice the pattern. The strongest features are about the heart and about emergencies, where a device you always wear has a real advantage. Now the caveats, because they matter enormously. Every one of these features is a screening tool, not a diagnosis. The ECG, for example, is a single lead tracing. It looks at your heart from just one angle. A hospital ECG uses 12 leads to see the heart from many directions, which is why it can detect heart attacks and other problems the watch simply cannot. The Apple Watch is specifically designed to detect one thing, AFib, and even then it can miss episodes or occasionally raise a false alarm. So the golden rule is this: these tools are meant to prompt you to see a doctor, never to replace one. If the watch flags something, that's a cue to get proper medical evaluation, not a diagnosis to act on yourself. And critically, if you have symptoms, chest pain, breathlessness, a racing heart, you seek care immediately, regardless of what your watch says. A reassuring reading from your wrist is never a reason to ignore how you feel. Stepping back, the Apple Watch is a landmark, because it shows what becomes possible when you put a genuinely capable health sensor on the wrists of hundreds of millions of people. Conditions like AFib that used to go undetected until they caused a stroke can now be caught early, by accident, during an ordinary day. That's a real shift in how disease gets found. And it's a preview of where digital health is heading, a future where the everyday devices we already wear quietly keep an eye on our health in the background, and flag problems before they become emergencies. But the lesson of this episode is the balance. These tools are most powerful not when they replace medicine, but when they act as an early warning system that sends the right people to the right care at the right time. Impressive technology, used wisely, alongside real doctors. This is educational, not medical advice.